Your doctor has prescribed an Aerochamber Max valved holding chamber with flow view indicator and small or medium comfort seal mask for the treatment of your child's respiratory needs. Aerochamber Max VHC carries on the 20-year Aerochamber legacy of quality and brand performance and has been enhanced with several significant features to ensure maximum effectiveness and provide additional peace of mind for both patients and caregivers. The new Aerochamber Max valved holding chamber with flow view indicator and small or medium comfort seal mask is an indispensable tool that caregivers can use to ensure they actuate the pressurized metered dose inhaler in conjunction with their patient's inspiratory maneuver. When the flow view inspiratory flow indicator moves from the vertical position toward the patient is inhaling. As the patient stops inhaling or exhales, the flow view indicator returns to the vertical position. Another new feature of the Aerochamber Max VHC is StatBan. Unlike static-prone chambers, in which static-charged aerosol particles are attracted to the walls of a chamber, Aerochamber Max VHC with StatBan minimizes static charge and in turn increases aerosol suspension time for up to 10 or more seconds after the pressurized metered dose inhaler is actuated. It's important to remember that the Aerochamber Max VHC must be used consistently, correctly, and in a manner that your child will accept, so that the medication process is fun and beneficial to your child's breathing. I'd like to go over a few suggestions to make sure your child enjoys using the Aerochamber Max VHC. When using the Aerochamber Max VHC, you can gain your child's trust and overall cooperation by never forcing the mask on your child or attempting to treat while your child is crying. Make sure to give lots of praise and rewards in a soothing, encouraging voice when your child is using the chamber correctly. Practice short treatments by having the mask near your child's face. You can also use teddy bears like me, dolls, or even adults to pretend to use the chamber and make it look like a game. Or just let your child play with the chamber while offering encouragement. Other ways to make sure they get their medication might mean giving them the treatment when they are happy or even when they're sleeping. The last tip I have for you today is to let your child have some stickers to decorate the chamber and make it their own. Whee! Let's take another look at those tips that will help you and your child make treatment fun. Now it's time to see how to really use the Aerochamber Max VHC. I'll check in later to make sure you're on the right track. The new Aerochamber Max valved holding chamber was designed specifically for children. The following instructions will help you to treat your child effectively, ensuring all of the medicine your child needs gets to the right place, their lungs.
This is my son Carson, and like most kids, he is so ready to play and full of energy, but like more than 5 million other children in the U.S., he suffers from chronic asthma. But I don't ever have any problem making sure he takes his medicine because I have the Aerochamber Max valved holding chamber. He knows that the Aerochamber Max VHC will bring quick relief, and so do I. Well, first, I shake the PMDI to activate the contents. Then I take off the cap and insert it into the back piece of the adapter of the Aerochamber Max VHC. Then I place the mask on his face and I look closely to ensure a tight seal around his mouth and nose. Now I can see if there's a tight seal simply by looking directly at the flow view indicator here and watching it move back and forth. Then I depress the top of the MDI like so, and it releases the medication into the chamber. I count for 6 breaths by watching the flow view indicator. I wait about 30 to 60 seconds in between depressions and then administer another puff based on our doctor's instructions. Asthma and respiratory-related illnesses can certainly be difficult, but with the Aerochamber Max valved holding chamber, not only do I have the assurance that I have the right tools to treat him, I know that he's getting his medicine to the right place.
That's right, Judy. He'll always have his medicine, and you'll always have peace of mind. Now, how about we show how to clean the Aerochamber Max VHC? We wouldn't want to forget important information about using the device. It's care.
Well, Aero Bear, you're absolutely right, and I'm so glad that you showed up just in time while we demonstrate how to clean properly the Aerochamber Max valved holding chamber.
Great! Let's get started. The Aerochamber Max VHC should be cleaned before first use and then weekly, following the instructions seen here. An instructional insert is also included in the Aerochamber Max VHC package.
Remove the flexible back piece and the mask adapter assembly. Do not remove the mask from the mask adapter assembly. Soak the 3 parts for 15 minutes in a mild solution of liquid dish detergent and lukewarm clean water. Shake gently. Then rinse the parts in clean water. Shake out the excess water from the 3 parts and allow them to air dry by placing them on a clean towel or a sanitary area. To reassemble, fit the mask adapter assembly on the end of the chamber and twist firmly until the components securely lock into position. Center the alignment feature on the flexible back piece with the flow indicator and exhalation valve. Press firmly to seat back piece.
This video included instructions to assist in using the Aerochamber Max VHC with small or medium comfort seal mask. Rest assured that the Aerochamber Max VHC will provide the relief your child needs and give you and your child more time to breathe easy. Please remember to read the instructions included with the Aerochamber Max VHC in addition to watching this video. Monahan has a full line of respiratory products that include valved holding chambers, such as the Aerochamber Max VHC with flow signal whistle, ideal for adults and older, more coordinated children, and the Aerochamber Max VHC with a large comfort seal mask for patients who are older but may still have trouble coordinating. Just ask your Monahan representative or visit our website for more information. Until next time, this has been a production of Monahan Medical Corporation